Hi, I'm Deepesh Arora. I'm part of the founding team here at HealthOcta. We founded HealthOcta with a few core principles in mind. Number one, the idea was to blend medicine and technology together because we strongly believe that by doing that, we can lower the cost of healthcare. In addition, we believe that we can improve reliability of access to meaningful healthcare solutions through the use of technology. And that really is the reason why we are working on HealthOcta for the last 2 years. We built a really cool product at HealthOcta called VideoConsults. The idea behind VideoConsults is to enable healthcare systems, large institutions like hospitals, emergency departments, federally qualified health centers, or any healthcare institution for that matter, to be able to access to a subspecialty using telemedicine technology. We built video consults for ophthalmology at first. The idea was to be able to use fundoscopy cameras in a emergency room setting, for example, whereby the ER doctor is able to take images of the patient who needs any kind of ophthalmology care and be able to take those images, transmit them over our network to an ophthalmologist on the remote end who can be available to do a consultation and essentially provide an assessment on how to handle the patient's situation, irrespective of how far away that ophthalmologist might be. As long as the ophthalmologist is licensed in the state where the consultation is required and we're complying with the legal laws, this is an amazing way to improve access to such a subspecialty. We're extending the same principles that we built video consults with to another problem area in the industry. Diabetes is almost at the level of a pandemic. Close to 64 million people across the Americas suffer from diabetes. Less than 50% of the people who are diabetic actually go through an annual screening, which means that more than 50% of diabetics in America are at risk of preventable blindness, and they just don't even know about it. What we want to do with a product that we are already in the process of completing to build is to be able to provide retinal screenings using digital technology built by HealthOcta, where we've integrated high-end FDA-approved retinal imaging devices, and be able to take that entire solution so that PCP offices and general practitioners are able to provide screenings for diabetic patients at their office setting. This helps the patient from a convenience standpoint because the patient no longer needs to visit with an ophthalmologist. But at the same time, what we are able to do is take these images and bring them across the internet or our secured network to an ophthalmologist who's licensed in the state where the patient needs care and be able to read those images and provide an assessment. The ophthalmologist assessment gives us either a green light to the patient saying, hey, you're clear and you don't need to be screened for another year, or hey, I see something that is wrong and you need to be having a follow-up with your ophthalmologist. This is yet another way in which we are enabling better quality of care by bringing together the advantages of technology, the great solutions and the amazing products that are out there, and be able to then pair that up with your professional skills and offer some quality healthcare. I'm here today to enlist the support of ophthalmologists all across the United States so that you can be a part of our network. We promote your independence. We want you to be independent and practice independently. Work on your own time, set your own schedules, and read these ophthalmology images so that when these patients are screened at their PCP offices, wherever they might be, those readings can be transmitted over our network to your offices where you are able to do these readings and provide the quality healthcare that you are passionate about providing. So we're looking forward to your participation. And if there is an interest on your part, please sign up with us on the form below. Your sign up currently is really not a form or not any form of a commitment. Fundamentally, all you're expressing is your interest. We will get in touch with you, and as the solution is deployed in various states, we will be enlisting your support and participation as we roll out in the weeks and months to come. Really appreciate your help. Thank you so much.